Hello, Ole Johan. Thanks for joining us today. How are you?
I'm very well, thank you, and thank you very much for giving me the opportunity.
No, not at all. Not at all. I appreciate your time and your input. So, Ole Johan, do you want to just say hello and give us a bit of a background of where you're from and your work?
I'm from Norway. I work in Holmestrand, a little city of 25,000 inhabitants to the south of Oslo, where I am both general practitioner and public health officer. So I both practice family medicine and public health. It's a combination that is very common in Norway.
Great. Thank you for that. I much appreciate it. And you're also working with CPME, the Standing Committee for European Doctors. Tell me a
That's
bit about
correct.
that.
Yes. I've been vice president, or one of the vice presidents, since almost 5 years now. So I'm very pleased to have this European or international assignment as well.
Yeah, perfect, perfect. And we've at EFA we've worked with CPME on some issues of healthcare decarbonisation. That's why I was specifically thankful that you could be available to have a bit of a talk today, because I know you CPME is a bit concerned with this issue, and you're representing European healthcare. So it'd be good to get your opinion on some of these things. So I guess I'll just jump into the first question if it's okay for you. I just wanted to see, in terms of healthcare staff in Europe, what do you see as the critical issues at the intersection with health and climate change?
I think that doctors or healthcare professionals in general, they have to raise the awareness of health impacts on climate change, both among their patients, but also among policy makers. Public health officers should work with policy makers at local, regional, and national, even international level, and they should raise this awareness of these impacts at all these arenas. And they also have to advise how to adopt sustainable and healthy lifestyles, because a reduction in the disease burden in the society is one of the ways that we can actually reduce our footprint of climate change as an important sector in society. And I think also that environmental awareness should be integrated into the training courses and curricula for medical students, but also for the specialist CPD programs for physicians.
Yeah, I appreciate you saying all of that. It's such a good point, and that's reflected in some of the conversations I've had recently, that there needs to be this strong thread of sustainability through all teaching of healthcare staff, and yeah, I particularly also appreciate what you said there about reducing chronic disease as a way to reduce footprint. That's coming out in a lot of the literature as well, and I think it's good to see those intersections between public health work and environment work in that way as well, and that we need kind of to focus on general well-being and general health as well. And yeah, so I think it's a really great point. So I guess this is probably a leading question. I think I already know the answer based on what you just said, but do you think there's a role for European healthcare staff in sustainability and decarbonising healthcare?
Yes, of course, because the health sector accounts for about 4.4% of greenhouse gas emissions, and even more in Europe. 4.4 is at the global level. So we have to contribute to reduce the consumption and disposal of health-related products, and we have to be aware of how do we heat our buildings, how do we use energy, and how can we reduce the transport by well organizing healthcare systems in a way that patients and healthcare providers do not have to move that over such long distances and so on. For example, it's better to make one doctor go from one city to another than moving maybe 10 or 20 or 30 patients the other way.
Absolutely, that's a really good point, actually. Yeah, I guess with the debates about telemedicine and things like that, currently. So yeah, there's lots of opportunities there, and I appreciate the call for action there. So when we're considering these factors, what should healthcare staff do on how should they go about this on the local level of their organization, their healthcare organization? What are some tips that you would say to people who want to take action locally?
Well, in the contact with patients, is very much about lifestyle and preventive medicine, but it's also about giving all the relevant informations to policymakers and policy decisors who decide how to organize societies, how to organize a healthcare system, and we have to we have to contribute with our knowledge into all this to make a smaller footprint of all our activities.
Yeah, I couldn't agree more. Very well put.
One other example is waste management. I mean, we could at least in Norway, waste management is very well done and organized at individual levels. But for societies, for big, I mean, for example, healthcare system, clinics, and so on, it's not at all that well organized. We can do much more efforts when we are at work, as we do when we are at home.
Yeah, it's a really good point about kind of connecting all of these things. I guess that leads nicely into my last question then. So, like, if people want to take action in their hospital or in their clinic, what messages from public health and from general practice and from sustainability should healthcare staff focus on when they're talking to their managers? What are the things they should emphasize if they want their organization to be more climate friendly?
Well, I think this should emphasize on the fact that healthcare providers, they are the ones who are actually working, who are producing in clinics, in hospitals. And that means that they are also the ones who are producing the most of the waste. But they may also have competences in how to use the buildings, how to heat the buildings, and give advices to their manager, and make them responsible for motivate them for the decarbonizing, waste management, heating, organizing, and that actually those people who work there and the patients as well, that they want sustainability. That is in our time, and we have been working the same way as we have always done for too much time. So we have to change this both at work and at home. And I think that doctors, they are often seen as trustworthy. They also have to give example in the way that they work and how they live their lives. I mean, doctors, they are among the most privileged people in our societies. They shouldn't go using too much energy all the time only because they can afford it. I mean, we all have to show the good example.
Yeah, absolutely. And it's such a good point, because part of why we're having these interviews is that we're sending this out to people who are concerned about decarbonisation and air pollution and climate change, and who want to take local action. So that's really good. It's a really good call, I think, to say that we should be doing these things, and we should use our health science background with these new things we know about sustainability to affect local change. So I really appreciate you saying all of that, Ole Johan.
And we can also point out how climate change affects health. I mean, absolutely. If we reduce climate change, we will surely also reduce the health effects, and then we will reduce the burden on the healthcare system.
Exactly. Yeah, it's it couldn't be clearer, could it? We really need to do this for the benefit of now and for the future, and for the way we work in general. So yeah, I couldn't agree more. Yeah, thank you so much for that. I really appreciate your time today. Thank you for bringing forward all of those positions. I think you've made a very convincing point of how we need to go about doing this in the future. So thank you really much, very much for that, Ole Johan.
Thank you for giving us the opportunity.
All the best. Thank you.